Hi, this is Deborah, and today I want to go into a little bit more depth about my spinal fusion. I also had a laminectomy, discectomy. I didn't say vasectomy, discectomy. My scar's about this long, and it's not very wide at all. When I came out of surgery, the doctor came to see me, and he said, "Debbie, your back was a mess." I had a slip disc and a herniated disc, and I had been living with the pain for about 5 years. And when the pain got so bad I couldn't stand it anymore, I went for it. I really didn't have a choice. I got up one morning just screaming. I couldn't even walk, and I had to call my brother to come and help me. But they had me walk up and down a flight of stairs at Inova Hospital in Fair Oaks, Fairfax. I was amazed at how quickly they got me up. I did have to wear the back brace for 3 months, and I did follow the doctor's rules to a T. You were supposed to drive for about 30 days, but I had no choice. After about the 20th day, I had to drive. Oh gosh, you hear that horn? I did have to drive to the post office, and I drove very slowly and avoided the potholes. And I didn't lift anything heavier than a gallon of milk. And you can't like bend over to like load the dishwasher. You have to like get down on one knee, or there's a certain way you have to do that chore. But my granddaughter and my grandson helped me in my recovery. And I think I was in pain for about 2.5 weeks, and then I went on to Tylenol. The thing that really bothers me the most is when my family and friends, they think because I look okay that I am okay, but I get really tired and I have to lay down and stretch out. I think that's just to relieve some of the tension on the screws. After all, there are 6 of them, and sometimes when I drive, if my seat is not correct, I can feel the screws, and it kind of like digs into me. But it's a lot of shifting and changing your the way you're sitting, constantly wiggling, you know. But yeah, you really need to educate your family and friends as to what has happened. Some people don't understand. But whatever. I am glad I had it. If you're in incredible pain, go for it, because who wants to live in pain? And I'm supposed to have the cervical fusion, but I've kind of put it off because I have a friend who already had it like 6 months ago, and they have to go back in and put in a bigger plate. And he really had also had a screw loose. He actually did have a screw loose. But he's going into surgery this week, and I feel so sorry for him. He was in a lot of pain. You know how you can tell when someone's in pain? When their voice changes. Their voice gets a little deeper. Yeah, but yeah, I have very good success with my spinal fusion. So good luck if you're contemplating it. But make sure you get a board-certified doctor. And my mother suggested that I get a newer surgeon who's also an orthopedic surgeon. And so this doctor fit the bill, Dr. Silveri. Bye.